Here are 5 signs an elderly person may be in their final year. You shouldn't ignore this. It is a profound and often unsettling realization when we observe subtle yet deeply concerning shifts in the demeanor or physical well-being of a beloved family member over the course of a year. This can stir a deep sense of unease, particularly given the common misconception that the final chapter of life often arrives without any forewarning. However, the reality is far more nuanced and tender, a truth that is frequently overlooked. The human body, in its extraordinary wisdom, frequently communicates its impending transition through quiet, gentle whispers, sometimes months or even a full year before the very end. Tragically, these vital clues, which may appear insignificant at first glance, are often missed. It is only in retrospect, as families look back, that the pattern emerges, revealing the signs that were always present yet unread. By then, the precious opportunity to prepare, to create those irreplaceable final memories, and to offer profound comfort has often slipped away. But what if you possessed the ability to understand this silent language? What if you could recognize these profound shifts not with dread, but with the empowering clarity of preparation and boundless love? This exploration is not about inducing fear. It is about empowerment, about equipping you with the vital understanding needed to navigate one of life's most challenging passages with grace and intention. We are going to illuminate 5 critical signs that frequently manifest approximately a year before an elderly loved one embarks on their final journey. Some of these changes may already be noticeable to you, perhaps dismissed as simply a natural part of aging. Others might seem minor, almost imperceptible, yet they are potent signals of the body's gradual, inexorable decline. By recognizing these signs early, you unlock an invaluable opportunity to elevate the care you provide, to truly cherish and savor every meaningful moment, and most importantly, to ensure that your loved one's final stage of life is enveloped in comfort, dignity, and profound peace. Stay with us until the very end, because these 5 crucial insights will not only help you prepare emotionally and practically for what lies ahead, but will transform your ability to make the most of every remaining breath, every shared smile, every loving touch. When you understand what is truly happening, you will not be caught off guard. You will be able to create a legacy of love and presence that will endure forever. One of the earliest and most profoundly telling indicators that an individual may be approaching the final year of their life is a noticeable and unintentional weight loss. Initially, these changes might appear quite subtle. Perhaps a belt that unexpectedly requires tightening, clothes that seem to hang more loosely, or a once robust appetite that gradually begins to wane. It's a common human tendency for families to attribute such shifts to the natural process of aging, brushing them off as an inevitable part of growing older. However, the truth is far more complex. Losing a significant amount of weight without actively trying to do so is rarely a benign sign, especially in the elderly. This often signals that the body is no longer efficiently absorbing vital nutrients, that muscle mass is decreasing at an accelerated rate, and that essential bodily systems are commencing a gradual slowdown. While some muscle loss is a natural consequence of aging, when this decline occurs too rapidly or significantly, it invariably points to a deeper physiological struggle. The body may be losing its capacity to digest food properly, or the individual might no longer be able to process protein effectively, leading to what is known as muscle wasting. This profound loss of strength transcends mere difficulty in movement. It dramatically elevates the risk of falls, severely compromises the immune system, and leaves the person far more vulnerable to a range of infections, turning what might once have been a minor ailment into a serious health threat. Furthermore, a significant component of this weight loss in the final year of life stems from pronounced changes in appetite. Many elderly individuals simply cease to experience hunger with the same intensity they once did. Their sense of taste can diminish, rendering once-loved foods unappealing, leading them to skip meals entirely or consume dramatically smaller portions. This isn't merely a shift in preference, it's a profound physiological adaptation. The body, sensing its impending shutdown, reduces the signals sent to the brain that typically prompt the desire for food. The cumulative result is a dramatic decrease in energy, a palpable loss of strength, and an accelerating decline in overall health and vitality. Underlying medical conditions also play a pivotal role. Weight loss is a frequently observed symptom of chronic diseases such as cancer, advanced heart failure, or kidney disease, all of which can progress stealthily long before more overt symptoms become apparent. Even mental health challenges like depression or the progression of cognitive decline can lead to reduced food intake, initiating a dangerous downward spiral where the body simply cannot acquire enough fuel to sustain its most basic functions. While well-meaning families might attempt to counter this by encouraging more eating, offering favorite dishes, or supplementing meals with nutritional drinks, if weight loss persists despite these earnest efforts, it becomes crucial to recognize that the challenge extends beyond mere diet. It's the body meticulously preparing for a deeper, inevitable transition. At this delicate stage, forcing large meals often proves counterproductive. Instead, the focus should pivot towards comfort, providing easily digestible foods and ensuring adequate hydration, all of which contribute far more meaningfully to maintaining a cherished quality of life. Therefore, if you observe significant and unexplained weight loss in an elderly loved one, particularly when accompanied by reduced eating, increased weakness, or a struggle to remain active, it is imperative to pay close attention. This is not solely about their physical appearance. It is the body transmitting a profound message, and understanding that message now can empower you to approach the journey ahead with clarity, profound compassion, and the ability to imbue every remaining moment with unparalleled meaning and love. Following closely on the heels of weight loss, another strikingly evident change in the year preceding the end of life is the onset of profound, unyielding fatigue and an overwhelming sense of weakness. This isn't merely the common tiredness experienced after a long, busy day. It is a deep, persistent exhaustion that defies rest and renders even the simplest of daily tasks monumentally challenging. Rising from bed transforms into a Herculean effort. Walking across a familiar room demands immense concentration and energy, and activities that once felt entirely routine, such as cooking, dressing oneself, or even sustaining a coherent conversation, begin to feel utterly draining. This pervasive fatigue is not simply a byproduct of aging itself. It's a poignant signal that the body is meticulously conserving its diminishing energy reserves. As the function of vital organs gradually decelerates, the body instinctively begins to prioritize, directing what little energy remains to the most essential systems. The heart's pumping efficiency may lessen. Circulation throughout the body weakens, and muscles no longer receive the same abundant supply of oxygen they once did. This physiological shift profoundly explains why many elderly individuals in their final months experience an all-encompassing weakness, a notable unsteadiness, and a diminishing capacity to maintain the level of activity they previously enjoyed. A crucial contributing factor to this extreme fatigue is a widespread metabolic slowdown. The body, an intricate machine designed for the production and utilization of energy, begins to redirect this energy as it prepares for its ultimate phase. Instead of fueling robust movement and engagement, the body shifts towards a state of preservation. This explains why someone in decline may start to sleep considerably more, requiring longer and more frequent naps throughout the day, and finding it increasingly difficult to remain awake for extended periods. Some may even experience abrupt, precipitous drops in energy, appearing perfectly fine one moment only to be completely drained the next. Perhaps the most poignant dimension of this physical transformation is its profound emotional impact. Many seniors who have long cherished their independence often find themselves wrestling with deep frustration, even embarrassment, over their newfound inability to perform tasks they once managed effortlessly. This can lead to a withdrawal from conversations, a reluctance to engage in social interactions, or a gradual cessation of beloved hobbies, not out of indifference, but out of a sheer, debilitating lack of energy. This can unfortunately initiate a cycle of isolation where the individual ceases to try altogether, inadvertently accelerating their decline. For families, witnessing a loved one transform from an active, engaged individual to one consumed by exhaustion and withdrawal can be heartbreaking. It's easy to misinterpret this as laziness or a lack of effort, prompting well-intentioned but ultimately unhelpful urges to push through it. However, the profound reality is that forcing activity will not alleviate the underlying physiological changes. What truly matters most at this stage is a deep understanding of their newly defined limits, granting them the essential rest they require, and dedicating efforts to making their remaining days as deeply comfortable and peaceful as humanly possible. If you observe in a loved one a profound, ongoing fatigue that simply does not dissipate with rest, consider it a clear and undeniable sign that their body is undergoing a major life-altering transition. This is the precious time to savor quiet conversations, to create moments of profound peace, and to offer unwavering support without imposing expectations. For in the end, the measure of love isn't about how much they can still do, but rather how deeply they feel loved, understood, and at profound ease. As an individual approaches the final stage of life, one of the most profoundly striking and often distressing changes can be observed in their cognitive function, their capacity to communicate, and their overall interaction with the world around them. You might begin to notice that someone who was once renowned for their sharp intellect and engaging presence starts to experience more frequent episodes of forgetfulness, struggles noticeably to follow the thread of a conversation, or appears disoriented even in places that have long been deeply familiar. They may find themselves repeating questions or stories, forgetting names that were once cherished, or losing all track of time, even if memory issues were never a significant concern before. These subtle yet significant cognitive shifts can manifest months or even a full year before death, and they transcend the realm of ordinary age-related forgetfulness. The brain, much like any other vital organ, requires a consistent and robust supply of oxygen and essential nutrients to function optimally. However, as circulation progressively weakens and the delivery of oxygen to the brain diminishes, cognitive function invariably begins to decline. This leads to the individual becoming easily confused, struggling intensely with decision-making, or finding it arduous to recognize people and places they have known for decades. In some particularly poignant cases, they may experience brief, fleeting moments of remarkable lucidity, only to be followed by sudden, disorienting episodes of confusion, as if their mind is gently yet perceptibly fading in and out of focus. Another increasingly common and often heartbreaking sign is an emotional withdrawal. Individuals nearing the end of life frequently lose interest in social interactions and external stimuli. You might observe them speaking less, engaging less actively, or spending extended periods simply sitting in quiet, profound silence. It's crucial to understand that this isn't a reflection of a diminished love or care for their family and friends. Rather, it's a physiological alteration where their brain no longer processes emotions and social engagement in the same intricate way. Conversations become profoundly tiring. Loud or busy environments feel overwhelmingly stimulating, and eventually, many seniors naturally retreat into their own internal world. Alongside this, you might also perceive distinct changes in their mood and behavior. Some individuals may become more irritable, exhibit heightened anxiety, or become easily frustrated by minor inconveniences. Conversely, others might seem unusually calm, almost detached, or appear indifferent to matters that once held immense personal significance. These aren't merely arbitrary shifts in personality, they are often a direct consequence of the brain adapting to the body's overall decline. As cognitive function slows, the nuanced expression of emotions becomes more challenging, and the individual may cease reacting to situations in ways that were once characteristic. For family members, this particular stage can be exceptionally difficult and emotionally taxing. Witnessing a loved one lose their grip on reality or emotionally withdraw can feel akin to losing them long before their physical departure. Yet, it is paramount to remember that these changes are beyond their conscious control. Instead of attempting to coax them back into normal conversations or engagement, the most loving and effective approach is to meet them precisely where they are, speak gently, offer profound reassurance through touch and presence, and understand that even if they do not always respond verbally, they can still profoundly feel your unwavering presence and love. If a loved one is exhibiting increased forgetfulness, heightened confusion, or a diminished engagement with the world, do not ignore these signs. They are often early indicators that both the body and mind are meticulously preparing for the ultimate transition. This is a sacred time to cultivate patience, to cherish quiet, shared moments, and to diligently focus on creating an environment that feels utterly safe, deeply familiar, and profoundly peaceful. For even when words fade, the enduring power of love and comfort can still be felt in every fiber of their being. As the body embarks on its gradual winding down process, one of the clearest and most observable physical indicators is a significant weakening of the immune system, transforming once robust defenses into a vulnerable state. You might begin to notice that an individual who rarely succumbed to illness now seems to contract every cold, every flu strain, and every minor infection circulating. What once amounted to a mild, fleeting illness now requires considerably longer periods for recovery, and even simple wounds, such as a small cut or a bruise, visibly heal at a remarkably decelerated rate. These interconnected changes are far from random. They are profound signals that the body is losing its intrinsic capacity to effectively defend itself against pathogens and to repair damaged tissues as it once effortlessly did. A primary concern within this context is the increased frequency of infections. Pneumonia, urinary tract infections, UTIs, various skin infections, and even oral infections become far more common as the immune system's efficacy wanes. Many families initially dismiss these as isolated occurrences. Yet when they begin to happen frequently or demand an extended duration to resolve, it is often a powerful sign that the body is losing its fundamental ability to fight back. Even antibiotics, which were once swift and potent agents of healing, may appear notably less effective. The individual might require stronger medications, prolonged recovery periods, or multiple rounds of treatment for infections that, in earlier times, would have been considered minor. This phenomenon occurs because, as circulation slows and the function of vital organs declines, the body simply cannot respond to medical treatments with the same vigor. Another frequently overlooked yet critical issue is the development of chronic wounds. If you observe that small scratches, persistent sores, or bruises are failing to heal properly or continually reopen, it strongly suggests that the body's circulation is significantly compromised. Inadequate blood flow means that oxygen and essential nutrients are not reaching the skin and deeper tissues efficiently, making the healing process dramatically slower than usual. Pressure sores, especially in individuals with reduced mobility, become a severe and ever-present risk, capable of leading to dangerous infections if not meticulously managed. What makes this phase even more challenging is that infections in the final year of life often do not present with the typical symptoms we expect. Instead of a high fever and pronounced malaise, an elderly person might simply appear more fatigued than usual, exhibit increased confusion, or show a diminished interest in eating. In fact, for seniors, a sudden and unexplained decline in mental alertness is frequently the earliest warning sign of an infection, often preceding the emergence of other, more conventional symptoms. This underscores why recognizing these subtle yet critical changes early can make an immense difference in the level of comfort and support they receive during their ultimate stage of life. For families, witnessing a loved one endure repeated infections can be both frustrating and deeply heartbreaking. There's a natural inclination to advocate for aggressive treatments, holding on to the hope that one more round of antibiotics or one more hospital stay will resolve the underlying problem. However, at a certain juncture, the focus often profoundly shifts from the pursuit of a cure to the provision of compassionate comfort. Ensuring adequate hydration, meticulously maintaining clean and moisturized skin, and actively minimizing overall stress on the body can contribute far more significantly to their well-being than repeated rounds of medication that may only serve to prolong suffering without truly reversing the inevitable. If you are noticing these signs in a loved one, frequent infections, abnormally slow healing, or chronic wounds, it is a clear call to deeper understanding and focused, compassionate care. Finally, one of the most profound and telling indicators that the body is meticulously preparing for its ultimate transition is the manifestation of major and noticeable changes in both breathing patterns and overall circulation. You might observe that your loved one breathes more slowly or shallowly than they previously did. At times, their breathing might include distinct pauses between breaths, or it could become strikingly irregular, unexpectedly speeding up rapidly before slowing down dramatically. Some individuals may experience a gentle, rhythmic pattern known as Cheney-Stokes respiration, where periods of deep, rapid breaths alternate with prolonged pauses, creating a distinctive ebb and flow. While these changes may begin subtly over time, they typically become more pronounced and occur with greater frequency. Accompanying this is a common sign of weakened circulation. You might notice that their hands, feet, or even their nose and ears feel persistently cold to the touch. The skin itself may take on a pale, bluish, or mottled appearance, particularly noticeable around the fingers and toes. This physiological shift occurs because the body is instinctively prioritizing blood flow to the most vital core organs, consequently reducing circulation to the extremities. It is a clear and undeniable indication that the heart is no longer pumping with its former strength and efficiency. Many individuals also begin to experience increased shortness of breath, even with minimal physical exertion. Simply sitting upright, speaking, or merely shifting their position might leave them feeling winded or gasping for air. You may observe them breathing through their mouth more frequently, or they might suddenly need to pause and catch their breath mid-sentence. If they were once capable of walking across a room with ease but now struggle profoundly to do so, it strongly suggests that their lung function is gradually declining. In some cases, a buildup of fluid in the lungs can exacerbate breathing difficulties, leading to a persistent cough, gurgling sounds, or a palpable feeling of tightness in the chest. While many might assume this is simply congestion from a common cold, in elderly individuals nearing the end of life, it is often a somber sign that the lungs are losing their capacity. This can render lying flat intensely uncomfortable, prompting them to seek solace in sleeping propped up on pillows or in a recliner to alleviate their breathing distress. For family members, witnessing these changes can be profoundly frightening. It is entirely natural to feel an overwhelming urge to help, to encourage deeper breaths, or to worry intensely that an urgent crisis is unfolding. However, in a great many instances, this is simply the body's natural, gentle process of slowing down. While there may not always be a way to reverse these physiological changes, there are always ways to enhance their comfort. Keeping the room cool and well ventilated, utilizing a humidifier, or offering small sips of water can significantly ease their discomfort. In some specific cases, carefully prescribed medications or oxygen therapy may provide relief, but crucially, the overarching focus definitively shifts from attempting to fix the issue to prioritizing profound comfort and tranquility. If you observe these distinct signs, notable changes in breathing, persistently cold hands and feet, or a bluish tint to the skin, it is imperative to pay close attention. These are often powerful indicators that the body is conserving its dwindling energy and that circulation is steadily diminishing. This becomes a sacred time to be fully present, to offer unwavering reassurance, and to meticulously cultivate a peaceful, serene environment where they feel utterly safe, cherished, and at complete ease. In these precious final months or weeks, the most invaluable gifts you can bestow are not always medical interventions, but rather the profound comfort, dignity, and the steadfast knowledge that they are never, ever alone. As we reach the conclusion of this vital conversation, we invite you to take a moment for quiet reflection on the profound insights we've explored. The subtle yet significant weight loss, the pervasive and unyielding fatigue, the gradual decline in cognitive function, the unsettling frequency of infections, and the profound changes in breathing and circulation. These 5 powerful signs often emerge in the year leading up to an elderly person's peaceful passing. It's important to remember that these indicators may not all manifest simultaneously, nor will they always be immediately obvious. Yet, when you begin to notice their collective presence, it serves as a powerful and gentle signal that the body, with its own innate wisdom, is preparing for its ultimate sacred transition. For countless families, these profound changes can be incredibly challenging to accept. It is a deeply human instinct to want to fight against them, to fervently encourage a loved one to eat more, to move more, or to simply push through their profound exhaustion. However, sometimes the most compassionate and loving action we can take is to simply listen, truly listen, to what their body is so patiently and eloquently telling us. Instead of focusing our energy on trying to reverse what is, in essence, an inevitable process, we can redirect our efforts towards making their remaining time as profoundly peaceful, as exquisitely comfortable, and as deeply meaningful as humanly possible. Understanding these signs is not about succumbing to fear or despair. It is about embracing the power of preparedness. When you are able to recognize these shifts early, you gain the invaluable capacity to offer better, more informed care, to make important decisions with clarity and foresight, and ultimately to ensure that your loved one's final months are filled with an abundance of unconditional love and unwavering dignity. This is a sacred season for cherishing every fleeting moment, for sharing precious stories, and for continually letting them know, through every gesture and every presence, that they are deeply valued and never alone. If you are noticing these powerful signs in someone profoundly close to you, take a deep breath. Remember, you are absolutely not alone on this profound journey. Countless families have walked this path before you, and while it is undeniably never easy, possessing the knowledge of what to expect can be an immense source of strength, patience, and ultimately a profound sense of peace. We hope these insights have offered you not just information but also comfort and a guiding light.